I'm Dr. John Mulhall. I'm the Director of Sexual and Reproductive Medicine in the Urology Service at Memorial Sloan Kettering Cancer Center in New York City. I'm also the Editor-in-Chief of the Journal of Sexual Medicine, and this video is aimed at educating potential reviewers or current reviewers for our journal to try optimize your reviewing skills. When we look at the 4 Rs of scientific publishing, a paper should be relevant, should be rigorous, reproducible, and most importantly, should be readable to the reader and for reviewers. This slide documents the classic 6 sins in scientific publishing. Plagiarism, not just from other sources, but from your own prior work, falsification and fabrication of data, authorship manipulation, failure to declare conflicts of interest, and reference coercion by reviewers who are encouraging authors to include their own papers in the reference list. So why do we write papers? We write papers for a variety of reasons, including to advance the field of sexual medicine, to introduce new therapies to the field, to establish our own independence, to collaborate with other investigators and authors, to gain insight into our own research via critique from reviewers, to advance our career, proof of one's competence through peer review, and proof of proper spending of funding when people have had national-level funding or funding from foundations. Why should you review? It is a fantastic way to learn the field. Methodology is critically important to being an excellent academic physician, and reviewing is a great way to understand methodology. Given that we are the official journal of the Sexual Medicine Society of North America and the International Society for Sexual Medicine, you're committing to your medical societies. It is also a means of academic advancement, and most importantly, from my standpoint as Editor-in-Chief, it ensures the best science gets published. So the first thing you have to decide on is, are you going to accept or decline the invitation that comes from me or one of our other Deputy Editors-in-Chief for the paper? And the questions you need to answer are, do you have expertise in the topic? Do you have interest in the topic? You're going to do a far better job at reviewing if you're passionate about the subject. Do you yourself have a conflict of interest? And by this I mean, are you in some way related to the authors or one of the authors? Were you a prior fellow? Were you their mentor? So one of the most important questions is, do you actually have time? I, as an Editor-in-Chief, would much prefer you to decline an invitation rather than accept it and then 3 weeks later realize you don't have the time. Finally, beware of predatory journals. Make sure that your invitation is coming from an agent of one of our journals in the family, Journal of Sexual Medicine, the Open Access Journal Sexual Medicine, or Sexual Medicine Reviews. So the purpose of your review is to ensure scientific rigor in the paper, to ensure the question that is posed is actually answered, the concept of a testable hypothesis, to ensure authors are not overselling their conclusions, to optimize data presentation, and to make the paper the best it possibly can be. And that is the ultimate goal of a reviewer for our journal. So your tasks are as follows. Make sure the paper is within your area of expertise. Make sure you are not conflicted. Do the authors have conflicts of interest? Do they declare or fail to declare these conflicts? Make sure the paper is formatted correctly and written well. Is the information novel or confirmatory? Review every part of the paper from the title all the way to the references. Be constructive. Choose your wording carefully. Choose words that you, as an author, would like to see a reviewer write to you. And never indicate your decision, whether it's accept, minor revision, major revision, or reject, to the authors. Those words are sent to the editors, not to the authors. So the structure of the review, are there comments to the editor? They should be to the point. And then you can expand on these points in your comments to the authors, which we as editors will read. Those comments to the authors should be critical, balanced, fair, and kind. Please number your points. It is very common that reviewers will write a paragraph with 10 points or more buried within the paragraph. In an effort to allow the authors to structure their response to you, please number out the responses and just address 1 point per response. With regard to the title, does the title reflect the purpose and conclusions of the manuscript? Is the number of authors appropriate? At JSM, we have a maximum number of 8 authors, and if there are more than that number, then the senior author needs to justify that to me. Are keywords present? And do you suggest the addition or deletion of any of the keywords? Is there a running header present? And is a funding statement present? This is very important. With regard to the abstract, make sure that the new JSM formatting is complied with. The abstract should be a standalone section. As many people now, when they pick up a journal, read only the abstract, we have increased the number of words from 300 to 400 with new sections, including strengths and limitations and clinical implications for clinical papers and clinical translation for basic science papers. From the introduction standpoint, the purpose of this is to set the stage for why the study has been done. It is not a section for a full review of the literature. Simply keep it short, and you need to address this with the authors. Are the aims clearly stated? Again, the testable hypothesis. From a method standpoint, the purpose of writing a method section is to facilitate other investigators reproducing the study, one of the most important R's in the 4 R's of scientific publishing. Encourage the authors to use subheaders throughout this section. Are there checklists that are completed? It used to be that these checklists were optional to complete, but now they are mandatory. Consort, Strobe, Prisma, Moose, and several others. Are the methods and design appropriate? Has a power analysis been conducted for the study? Was a validated instrument used? And if the validated instrument wasn't used in a study, then the authors need to justify why that is. Is there a detailed statistics section? And do you recommend a statistics consult? We have a statistics consultant who will review any paper that you believe is beyond your capability from a statistics standpoint. When it comes to the results, again, encourage the authors to use subheaders. Present the data, all the data. It is very common that in the method sections, authors will say, well, we used 3 instruments to assess our patients, but only present data on one of them in the results. If it's mentioned in the methods, the data should be presented in the results section. There should be appropriate data presentation, so all means should be accompanied by standard deviations or standard errors, and medians accompanied by interquartile ratios. It's important that you look and try to find if the data is only statistically significant without being clinically meaningful. This is very common in scientific research. And if you have expertise in the area, you should know what the minimal clinically important difference is and have they met that criterion. I think if there's a lot of information in illustrations, in figures, and in tables, there's no need to replicate that in the text. The final point in the results section is, are there appropriate callouts for tables and figures within the text? When it comes to the discussion, is the length appropriate? Now, this differs between original research papers and review papers. In the discussion, the authors should cite the relevant literature and critique it and compare and contrast that to their own data. They should also discuss the clinical implications of the data or the clinical translation if it's a basic science paper. It is incumbent upon the authors to include strengths and limitations. And you need to look for these, and if they are not there, you need to encourage the authors to include those in the revised document and make suggestions as to what those strengths and what those limitations might be. From a conclusion standpoint, this needs to be brief and to the point. It really should be looked upon as a take-home message. Are the results and the implications overstated, which is quite common? When it comes to tables, figures, and illustrations, they should be used judiciously. Are they readily understandable? Are the axes labeled? Are the legends informative? All abbreviations should be explained, and on histograms, there should be standard error bars. While there's a lot of discussion at the moment about the value of p-values and a p-value less than 0.05, the journal at this point in time, in 2019, still requires p-values to be cited. If there are photographics or illustrations in here, then they should be of high quality. And just make sure for basic science papers, Do the images look manipulated? From a reference standpoint, are the references contemporary? Do they represent the literature in the area? And is there a lot of self-citation? It's not uncommon for authors to self-identify during the manuscript, where they'll say, we have previously shown reference 16, and you can identify from reference 16 who the authors are. Is there a lot of self-citation of their own previous work? And this is worthwhile mentioning and having the authors justify this in their response to you. When you are communicating your decision, there are 4 decisions: reject, major revision, minor revision, and accept. Your comments to the editors need to justify your decision, and this decision should not be communicated to the authors. If you happen to agree to review a revised paper, and you may not see this paper because the decision may be made by the editor-in-chief or one of our associate editors, follow the aforementioned guidelines for reviewing the revised document. Make sure the authors have addressed all of your comments, and there are circumstances where the authors might actually disagree with the point that you've made. This is perfectly scientifically valid if they can justify why they disagree with you. It is very anger-inducing to authors if you introduce new suggestions on second review. Make a good effort on the first time at review to include all the comments that are important, and do not introduce new comments during the second review. All of our reviewers are assessed. There is a scoring system which is based on timeliness of review, the comprehensive nature of your review, how constructive your review is, and for people with consistently excellent scores, there are awards every year for outstanding reviewer. Consistently excellent scores translate into editorial board membership. If you're a junior reviewer, we would strongly encourage you to read the reviews from other reviewers, which you will receive in the decision email. So the take-home messages are: if you review for our journals, thank you very much. Reviewing correctly takes time. Please use the JSM template and the instructions I've given you here to assist in your review. Be constructive, and good reviews equals advancement. Good luck.